Hi, thanks for joining me for Monument Health's Insurance 101, where today we'll be talking about preventative care services. My name's Heather. I'm a population health coordinator with Monument Health, and today it's my goal to help you understand what exactly is covered as preventative care services. We'll cover the different types of visits, lab work, screenings, and vaccines that fall under preventative care today. Visits are what I want to focus on first. One important thing to remember is that a preventative visit differs from a regular office visit, both in what is discussed and what the benefits with your insurance for that visit are. Be sure to check your benefit grid of your plan so you know what to expect for costs when going to your provider's office. And if you have questions about your benefit grid or what particular benefits are, you can either call us here at Monument Health, or even better yet, go check out our other Insurance 101 videos to learn more. So, a preventative care visit is a visit that is annual or semi annual and is structured to help prevent serious illness or disease. It is covered at no extra cost to you through your health plan. You may see these visits called different names depending on your plan and what specifically is covered. So, most insurance plans will fully cover an annual physical, well woman check, and well child visit for individuals from birth to age 21. These visits are structured to address very specific topics such as vitals, family history, a review of basic blood work, health screenings, gender specific care needs, age specific needs, and your vaccination schedule. For Medicare affiliated plans, the covered preventative visit is called an annual wellness visit. This visit is not a physical and is strictly a discussion with your provider. You'll talk about your current health, medical goals, family history, lifestyle, habits, and do a medication review, risk assessment, and nutrition counseling. While these are the most common names for these types of visits, there may be other names that are specific to plans and age groups. All of these visits should cover similar information, though. Part of the annual visit is a review or draw of some basic blood work. This typically includes the complete blood count, or CBC, and a basic lipid panel. But be sure to understand what your specific plan covers as preventative before having any lab work done. Remember, if your provider orders other labs or they don't fall under the preventative care for your plan, there will most likely be additional lab costs that you are responsible for. Make sure to talk to your provider about what tests they want to do so you know what to expect from any labs that they order. You may be eligible for preventative screenings that are separate from visits and basic lab work. For each of these screenings, there are specific types, timing, and locations that you can go to have them processed. So, all adults age 45 to 75 are eligible for colon cancer screenings. There are a few different covered screenings that can be done, and these can differ in timing and locations for care. You can do an IFOBT, GFOBT, or FIT testing annually, which can be done through your primary care provider's office. The FIT DNA test is done every 3 years and is also available through your primary care doctor's office. And if you wish to work with a gastroenterologist, you have options such as a colonography or a flexible sigmoidoscopy, which is done once every 5 years, or you can choose a regular colonoscopy, which is done once every 10 years. Finding the right testing fit for you is a great topic to discuss with your primary care provider. And no matter which of the screening options you decide on, it's still going to be covered as preventative. Women ages 21 to 64 are eligible for cervical cancer screenings. This pap smear is done every 3 years. The screening is one that your primary care provider can complete for you. We encourage you to utilize your primary care provider for as many screenings as you can, but you are welcome to complete this with an OBGYN or midwife if you prefer. Breast cancer screening is available for women age 50 and older. Mammograms are typically done every 2 years and can be done at your Tier 1 imaging lab. Having a regular schedule of these preventative screenings is important to maintaining your health. Always talk to your primary care doctor about your screening schedule. And remember that if you need a second screening or if these are scheduled as diagnostic instead of preventative, there will most likely be additional lab or procedure costs. The last set of preventative services I did want to talk about today are vaccines. As with other preventative screenings, these are dependent upon age and other risk factors for if you're eligible for them. Talk with your provider about your vaccination schedule and which vaccines are appropriate for you. Remember that you are your best advocate for your health. Maintaining a regular schedule of preventative appointments with your primary care provider is key in maintaining your good health and helping your provider support you as well. I do want to thank you so much for taking some time to watch this video. You can reach us by phone or email, or even have many of your questions answered on our website. And don't forget to keep an eye out for our other videos, and make it a great day.